Let's start. Good morning, everybody. Today I'll be discussing.
Be near the mic.
Good morning, everybody. Today I'll be discussing on the topic as told by ma'am. I am Dr. MS Darshana, senior resident at GMC Mahasamud, and guided by Dr. Neha Thakur, ma'am, head of department GMC Mahasamud. Overactive bladder is common but often underreported in peri and postmenopausal women. OAB is characterized by urinary urgency, which is the hallmark symptom, increased daytime frequency, nocturia, and urge urinary incontinence. Estrogen deficiency contributes to lower urinary tract dysfunction. Symptoms adversely affect quality of life, sleep, emotional well-being, and daily activities. Most women remain untreated due to embarrassment or lack of awareness. Behavioral therapy is the recommended first-line treatment. Double voiding is a simple technique that may improve bladder emptying and reduce symptoms. This study therefore evaluated its effect in women attending a tertiary care center in Mahasamud. So the study design was the prospective interventional study, which was conducted between March 2025 to February 2026. Department of Obstetrics and Gynecology at GMC Mahasamud. A total of 46 women with OAB symptoms were included in the study, and the intervention was double voiding for 6 weeks. The assessment tools that were used were modified overactive bladder symptom score, and second was ultrasound post-void residual volume measurement. Active urinary tract infection and pelvic organ prolapse were excluded out of the study. The aim was to assess the prevalence of overactive bladder among perimenopausal and postmenopausal women attending a tertiary care hospital and evaluate the effect of double voiding on symptom relief. Objectives were to determine the prevalence and severity of OAB using the modified OAB symptom score, to assess post-void residual volume in women with OAB, and to evaluate the effect of 6 weeks of double voiding on OAB symptoms and PVR, to identify factors with OAB, including BMI and other comorbidities. So what is double voiding and why does it work? Double voiding is a simple behavioral technique that facilitates more complete bladder emptying and is defined as a second voluntary attempt to void immediately after completion of the initial void, irrespective of the presence or absence of a sensation of incomplete bladder emptying. So when the residual urine is still there in the bladder, it causes bladder distension resulting in increased afferent stimulation and thereby the symptoms of urgency and frequency present. In case of double voiding, there's a better emptying that occurs with post-void residual volume. There's a decrease in PVR and therefore the symptoms are improved in such patients. To assess the severity of OAB symptoms, we have used the modified overactive bladder symptom score, which evaluates a total of 5 components, that is daytime frequency, nocturia, urgency urinary incontinence, and a 5th component was adapted from International Prostate Symptom Score, giving a total maximum score of 20. Individual score ranges have been described here, and depending on the total score, the symptoms were categorized into mild, moderate, and severe. This table shows the demographic profile of the study participants, out of which a maximum were post-menopausal females, contributing to 58.7%. Nearly 2/3 had associated comorbidities regarding BMI. 43.5% were in the overweight category, and maximum of them were in the age group of 50 to 59 years. This table summarizes the number of patients that belong to the mild, moderate, and severe category. So maximum were belonging to the mild category, followed by moderate and severe. After 6 weeks of double voiding, there was an overall improvement in the symptoms, with a maximum reduction in the incomplete emptying score. And discussion. OAB prevalence was nearly 23%, highlighting it as a significant health concern among peri and postmenopausal women. OAB dry, 56.5% was more prevalent than OAB wet in the study population, suggesting that storage symptoms may occur even in the absence of urge urinary incontinence. Double voiding improves symptom severity, and modified OABSS decreased by approximately 17%, while mean PVR decreased by approximately 22%. Double voiding facilitates more complete bladder evacuation by allowing expulsion of residual urine during a secondary voluntary void. Reduction in post-void residual decreases bladder distension. And in addition to improving bladder emptying efficiency, double voiding may also provide secondary benefits in the form of modest reductions in urinary frequency, urgency, and nocturia. Clinical implications, it's easy to teach, no medication required, no added cost, can be integrated into first-line conservative management and may reduce need for pharmacotherapy in selected patients. Conclusion, it's a safe, inexpensive, and effective behavioral intervention and improves bladder emptying and reduces OAB symptom severity. Best outcomes are seen in early stage disease with mild symptoms. The limitations of the study were this study was conducted with a smaller sample size and longer follow-up is usually needed to establish the long-term efficacy of combined behavioral interventions.
Measure the post-birth urine after the first birth and second birth, because you told that the post-birth urine, residual urine, that has been improved. So have you done an ultrasonogram after first birth and after second birth? And what is the difference, time difference between the first birth and second birth?
We usually told them to wait for approximately 20 to 30 seconds and then we told them to wait for a period of 20 to 30 seconds and then reattempt voiding, ma'am.
Only 30 seconds.
That was the time that was asked.
You have written that post-birth residual urine has been significantly reduced. Then how within 30 seconds you can measure the post-birth residual urine?
Ma'am, we asked the patient to, after the first void, she was asked again to void, irrespective of the feeling of incomplete bladder empty. And she was asked to relax for a period of 30 seconds and then attempt to void again. And this was calculated after 6 weeks of therapy, ma'am.
Apart from this, suppose if you want treating, what are the other modalities of conservative management?
Ma'am, behavioral techniques are advice to the patient, as in we can ask the patient to increase the timing between the subsequent voids, and we can ask the patient to schedule her bathroom visits, and we can also advise the patient pelvic floor muscle training exercise. And in lifestyle modification, we can ask the patient to reduce her caffeine intake, as well as if she is alcoholic, in that case, we can ask her to decrease her alcohol intake at the same time.
Pelvic floor exercises also
Yes,
plays a
ma'am.
role.
Yes, ma'am. Pelvic floor exercises
also-
as well. That will strengthen the pelvic floor muscles and allow her urgency to hold for a while.
The associated symptoms you have described, that should be also first taken care of. If there is a urinary tract infection or diabetes, everything, anything, associated symptoms was present in around associated symptoms. You have written that there are so many 44% patients had an associated symptom. Before taking any measure, the associated symptoms should be taken care of. Like if there is an infection, that should be treated first. And also if there is diabetes or anything, any associated disease, that should be taken first. Because even if you do anything, whatever, maybe if there is something infection is there or something is there, that will not take any care.
And this middle-aged women, particularly if they are vegetarian, they will have B12 deficiency. That also affects the bladder function.
Okay. Thank you so much.
Thank you, Dr. Darshana. Our next candidate is Dr. Pratima Koshevara. Her topic is clinico-pathological profile of perimenopausal abnormal uterine bleeding, a prospective case series.